All right. Hello and welcome. Let's see here. And welcome to the Florida Medicare 101 webinar. I am your host, Chaz Mulheron. And for most of you, this is probably your first Medicare workshop. My goal for you today is to have a better understanding of Medicare and the choices that are available to you. This should last about 1 hour. So be prepared for that. Take some good notes. Have a pen and paper handy. And if you have any questions, you can use the chat function in the top right-hand corner there. Ask questions at any time. I typically answer them at the end of each slide. And with that, we'll go ahead and begin. It looks like everybody's audio is good. Okay. Okay, let's get started. All right, first you should know this event is for educational purposes only. No plan-specific benefits or details will be shared. And Chaz Mulheron, that's me, is not connected with the federal Medicare program. My mom just started Medicare in May, and she got tons of stuff in the mail. Every company, Humana, United Healthcare, Florida Blue, Cigna, every company. And they won't really tell you much about the plan other than, get great benefits and call here. That's going to be the same for you. And Medicare will not call you. Medicare will not help you with signing up for Medicare. They won't. If you call them, they can help you sign up with Medicare, but they won't show you any of the plans available. What I'm doing today is purely educational. If I were to go over every single plan that was available, it would take days, days and days. So hopefully you're ready just for education. If you want to talk in the future about plan specifics, I can definitely talk to you about that. All right, who are we? Well, we do educational courses designed for new people to Medicare, just like you. We do live classes and online classes. I do libraries here in Central Florida. Our office, Florida Retirement Group, is located in Maitland. It's North Orlando area. Today, you guys are probably all on the East Coast, Melbourne, Indian River, maybe Stewart, Port St. Lucie, stuff like that. But I do have clients statewide. All right, my name is Chaz Mulheron, your Medicare guru, your Medicare guide, I should say. If you go on to the Department of Insurance for Florida, you can Google that and you can enter in my license name right there. You can see that I'm a real licensed agent, but my name will show up as Charles Mulheron. I'm Charles III, but I've gone by Chaz my whole life. And I got licensed in February 14th of 2009. So now about 13.5 years I've been in the business. All right, what are we going to talk about today? Well, we're definitely going to go over the four main parts of Medicare. That's your Part A hospital, your Part B medical, your Part C, those Medicare Advantage plans you guys are probably seeing on TV with Joe Namath and Jimmy Walker. We'll also talk about Part D, your drug plans, Medicare supplement plans, and then when should you enroll? If you don't enroll, will you be penalized? What if you're still working and have coverage from an employer? How does that all work together? So we'll definitely talk about all of that today. All right, did you know that Medicare first started just hit 57 years? What is that? A few weeks ago. So July 30th, 1965, and the first recipient was President Truman right there. And that is what the Medicare card used to look like on the right-hand side. It no longer looks like that today. It also used to have your social security number on there. You can see it at the top. They would put your social. They no longer do that anymore. Because you guys are not in front of me, I'm going to go ahead and show you what a Medicare card looks like. Typically in the room, somebody will have one, but this is what your Medicare card will look like when you get it sometime this year or next year. It'll have your name on there, your Medicare number, even though it has letters in there, it is a Medicare number, they call it. And then you're going to have your Part A and Part B effective dates on there for Medicare. It's no longer your social security number. It's a random generated letters and numbers. All right, let's go back here. Medicare versus Medicaid. I know back in 2009, if you would have asked me then, prior to me getting into the business, I would have never known the difference between Medicare and Medicaid. So I want to make sure you know kind of a rough difference of the two. Medicare is why you're here today. You're most likely turning 65 soon, this year or next year. So that makes you become eligible for Medicare because of your age. You could also get Medicare earlier if you have a certain disability or end-stage renal disease. So that's Medicare, usually because of age or disability. Medicaid is different. Every state is different, depends on the state that you live in, but they have different income limits. Every state is different, like I said. So in Florida, they might say, hey, if your income is under X amount of dollars, you can qualify for Medicaid. Oh, and they look at your assets as well. So it's income and assets. If you get Medicaid from the state, they'll help pay for your Medicare cost, but not everybody gets approved. Most people don't. But if you do have limited income, definitely talk to me and we can see if you can qualify for Medicaid. Those people are called dual eligible, that have Medicare and Medicaid together. All right, let's go here. Next page. All right, Part A and Part B of Medicare. That's your original Medicare. Like I said, that's what started back in 1965. 57 years now. So when you get your Medicare card, whether it be this year, next year, or maybe you're going to get Medicare 5 years down the road, eventually you're going to have a Medicare card, your Part A and Part B. You don't have to do anything else. I know you guys are seeing tons of stuff from every company saying you have to make your decision, but in reality, you don't have to. You can take your Part A and Part B Medicare card and start using it if you're hospitalized or if you go to a doctor. That's what your Medicare A and B will do. I want to make sure you know what that card will do for you, though. It's changed over the years. Back in 1965, that's all you needed, that A and B card, and it had great coverage. As we all know, the Medicare system is definitely losing a lot of money. So the copays and deductibles have been increasing a lot in the last 20 or so years. So first, I want to talk to you about Part A. Part A, we know your card says hospital, right? Remember, I'm going back one slide here. Part A on your card, it's just going to say hospital, though. And it will start on the first day of your birth month, unless you're born on the 1st. So we'll use myself as an example. My birth date is January 27th. Even though it's at the end of the month, I would start Medicare on January 1st if I were starting Medicare this coming year. The only way that's not true is if your birth date falls on the 1st of the month, then you get it a month early. So I'm going to assume you guys are going to start it on the first day of your birth month. Now, Part A typically has no monthly premium. If you're taking notes, write that down. Part A is free. Now, when I say free, I mean that you're not going to pay for it every month to be on Part A. Okay, that's assuming you've paid 40 quarters into the Medicare system. We know that every time you get a paycheck, it says on there, Medicare taxes, Medicare. That's paying into the Medicare system. Or if you're like me and you get 1099, when you do your taxes, you're paying in for Medicare as well. So 40 quarters is 10 years. As long as you paid for 10 years, your Part A will be free. Now, what if you never worked, or maybe did not work that 10 years? And you say, Chaz, am I going to have to pay for Part A? I'll say, well, it's possible. You could pay as high as $499 a month for Part A. But I would actually ask you, have you ever been married? Did that spouse pay into Medicare for 10 years? If the answer is yes, then you can get Medicare from them and you won't have to pay Part A. So don't just automatically assume you got to pay for Part A. Make sure you talk to me. We can try to find another avenue for you. All right, so we know Part A is free, right? Now, let's say you're like me and you start Medicare in January. Your Part A of Medicare starts then, and all of a sudden, knock on wood, hope it doesn't happen, but you get hospitalized as an inpatient. You call me up and say, Chaz, I was just hospitalized. Or actually, if you just said, I went to the hospital, my first question is going to be, were you hospitalized as an inpatient or an outpatient? If you said, oh, no, I was an inpatient, I'll say, okay, that's going to fall under Part A. So even though Part A says hospital services, it only means if you're admitted as an inpatient. They will pay for a semi-private room, meals, general nursing, hospital services and supplies, and all but the first 3 pints of blood. You're responsible for that. It does not cover private duty nursing, comfort, and convenience items. Now, I just said that Part A was free, but guess what? There's going to be some gaps in Part A. When I say gaps, it means what will Medicare not pay, and instead you would owe. It's a gap in Medicare. Okay. Um, by the way, I should mention too, this is all for 2022. I know some of you might be starting Medicare next year. I won't have those numbers until the end of the year, but rest assured, these numbers will be higher next year. They always are. So the first gap in Medicare is days 1 through 60. So if you called me up and said, Chaz, I just spent 3 days in the hospital, what is that going to cost me? I'll say, well, that falls in between as an inpatient days 1 through 60. You have a 60-day window that you could be hospitalized, and you're going to pay $1,556. And again, this is if you have nothing else. You have no coverage from your employer, no Medicare supplement, Advantage plan, nothing but just Part A and Part B. If you're hospitalized, you're going to pay $1,556, and that covers you for a 60-day window. Now, let's say you go in for a few days, you come home, the clock is still ticking. You can go in the hospital within that 60-day window and still be covered because you've already paid for that 60 days. But let's say you come home and then 3 months later, you get hospitalized again. Well, that's you start back on day 1, a new 60-day benefit period, and you pay $1,556 again. So it can be paid multiple times per year. Now, what happens if you blow on through those 60 days, you're still in the hospital? The longer you stay in the hospital, the less Medicare is going to pay. And of course, the more you're going to pay. So days 61 through 90, you would then owe $389 every day that you're in there for those 30 days. In the next 60 days, days 91 through 150, you would owe double that, $778 a day. These are all gaps of Medicare, which they're not covering. These numbers used to be really, really small, 50 years ago, but they have grown rather large. You also were responsible again for the first 3 pints of blood. Anything beyond 150 days in the hospital, you are on your own. Medicare will not pay a dime. And then comfort and convenience items. Sometimes people look at this and say, wow, I didn't realize they don't cover that much. You will get a Medicare and You book sent to you automatically for Medicare. Like I said, Medicare doesn't help you find plans or anything. They give you a book and they say, here you go. That's why it's good to have an agent like myself. We never charge you anything. We just help you find plans. But that book will tell you about Part A hospital, Part B. It will go into all these details and all the numbers right here. The next part of Part A, so we're still under Part A, is what happens when you get out of the hospital. Clients will call me and say, hey, Chaz, I was hospitalized for a few days. Now they're telling me I'm going to a different wing of the hospital, skilled nursing care. This is inpatient only. Remember, Part A is only inpatient. If it's not inpatient, it's not under Part A. But Part A, skilled nursing care, Medicare says as long as you spend 3 days inside the hospital as an inpatient, we will then pay the first 20 days for you in skilled nursing care. You will not pay anything. And they typically will tell you, oh, we'll have you out of here within a few weeks. The average stay might be 10, 14 days or so. But if some reason, if you needed to stay longer, you just were getting better a little slowly, you need around-the-clock care, days 21 through 100 would cost you, the gap in Medicare would cost you $194.50 every day that you're in there. I had somebody last year stay 38 days in skilled nursing care. So it can happen. Hopefully not to you, but it does. Anything beyond 100 days, Medicare will not pay anything. They bow out. They say, hey, we're not going to cover long-term care. Medicare is here to get you better, pay certain amounts, and get you out of the hospital. So if you need long-term care coverage, Medicare will not pay it. Maybe Medicaid will. Medicaid, remember, you exhausted all of your assets and your income's low. You can get Medicaid. Also, long-term care insurance, if you happen to have that, or just cash out of your pocket. But Medicare does not cover long-term care. All right. If you have any questions about Part A, feel free to ask. I know it's a little different online, but I don't mind you using that chat function up there if you do have any questions. I'm going to put a little question up for you myself. We know that Part A is free this year. How much do you think Part B is this year? Okay, I'll go on while you guys are answering that. All right, so what is Part B? Part B is medical. Remember, your card's going to say Part A hospital and Part B medical. Part B medical, just think of everything outpatient. If you want to write anything down, it's all outpatient services. So think of your primary doctor, your specialist, urgent care, emergency room, chemotherapy, outpatient surgery, ambulance. If it's outpatient, then it's going to fall under Part B. Part B will only start on the first of the month. So using my example again, on my birthday's in January 27th. If I were to start Part B of Medicare this coming year, I would start Part B on January 1st. But Part B is optional. Why is it optional? Unfortunately, there is a Medicare premium. It is not free. So if you have a pen and paper, if you're taking notes, write this down. Part B this year for 2022 is $170.10 every month. Next year, they're talking about lowering it a little bit. I know that sounds crazy. I've seen it happen before, but they have mentioned that they're probably going to lower it by like $4 or $5 next year. But this year, it's $170.10 every month. And guess what? If you don't take Part B when you're first eligible, meaning that you turn 65, there is a 10% penalty for each 12-month period that you were eligible to take Medicare but decided not to take it. That penalty, if you get one, will last forever. Now, there are limited exceptions. So if you have coverage from your employer, listen up. If you are working, or maybe your spouse is working, and you have creditable health coverage from that employment, you can delay Medicare. Now, there's two things here. One, it has to be 20 or more employees. So if it's I had somebody recently that was working at a church, and they're like, no, we only have like 8 or 9 employees. So that is not a reason why not to take Part B. You could be penalized. So it has to be more than 20 employees. It also has to be creditable to Medicare, meaning the coverage has to be at least as good as Medicare offers. If those two things are true and you're still working, you can delay Medicare until you're ready to retire. When can you enroll in Medicare? You can enroll in Medicare during a 7-month window, 3 months prior to your month of eligibility, the month of, and up to 3 months after. So if your month of eligibility is January, like me, then you would be able to enroll in Medicare October, November, and December. Then you would have the whole month of January. Then you would have 3 months after. If you wait that long, do not wait that long if you're just kind of not getting to it. You want it to start on your birth month. But if you do wait, you do have 3 months after your month of eligibility. And then after that, your penalty will start to accrue. So don't delay. I should mention too, a lot of times people will say, well, Chaz, I have coverage from my employer. Can I delay it? You have to talk to me because we got to make sure one-on-one that that's what you are able to do. But what if you have an ACA plan, otherwise known as a marketplace plan or Obamacare? That is not creditable. You will lose any subsidy once you turn 65. My mom was paying, she had Cigna, I believe, or Florida Blue. No, I think she had Cigna prior to starting Medicare in May, and she was paying like $30 a month. She said, Chaz, I don't want to go on Medicare. It's $170 a month. I don't want to. Unfortunately, Mom, if you keep your current coverage, your premium will no longer be $30 a month. It's going to be $800 a month. You're going to want to go on Medicare, and it's not creditable, so you get penalized in the future. So she had to go on to Medicare. The first gap for Part B, remember the gaps are what will Medicare not pay? The first gap here is a $233 deductible. A deductible is not a premium. I should let you know because I know a lot of people do get that confused. It can be interchangeable there. A premium is how, like, think of a cable premium or your cell phone premium. It's what you pay every month to be on it. A deductible is what do you pay for using services before Medicare will pay anything. So even though you're paying monthly for Medicare, Medicare says we're not going to pay anything for Part B until you spend the first $233 out of your own pocket. Then Medicare says once you've met that requirement, we will pay 80% for all of your Part B services. Remember, Part B is everything outpatient. And then you're responsible for 20%. Not bad. We're kind of used to that. I have insurance. I have an 80/20. I have a $2,500 deductible on myself. Once I meet my deductible, let's say I were to get an MRI done and spend $2,500 for it, then anything for the rest of the year, I would pay 20%. Same thing for you guys. 233 deductible, you pay 20%. The problem with this 20% is there is no maximum or no cap to that 20%. Most insurance, if you have insurance right now, I'm sure you can look at your summary of benefits and you will see a maximum out-of-pocket responsibility, meaning that if you were to spend that maximum amount of pocket, let's say it's $5,000, you have 100% coverage for the rest of the year, telling you that I know in my worst year, I can't spend more than X amount of dollars. With Medicare, there is no safety net there. That 20% is infinite. If you have a $50,000 bill, you're going to pay $10,000 and so on. So be careful with that. I feel like they should add a maximum out of pocket someday. They've talked about it, but they just never do it. Last thing here is very, very rare. But what this says is that let's say you go to your doctor and that doctor says, oh yeah, I take Medicare. I'll accept your Medicare card as payment. You pay your portion, Medicare will pay their portion. But I don't like what they're willing to pay me. So I want to charge an excess fee or an excess charge. They're allowed to charge up to 15% above what Medicare approves. It's very rare. If you're curious and you want to know, does my doctor charge any excess fees? You can go to Medicare.gov. Make sure it's .gov, not .com. So Medicare.gov, just find a doctor, type in your doctor's name, and it'll tell you if they charge the Medicare approved amount or not. And I'll tell you now, especially in Florida, it's very rare. I did see one doctor about 5 years ago down in Miami. He charged the excess fee. It's very rare, but I did see that one time. Okay, so we got Part A hospital, Part B medical. We know the gaps in there. That 20% is a gap. That 233 is a gap. That 15% is a gap. A gap is what you owe if you have just Medicare A and B. Now we're okay. So we still got Part B here. The Part B premium we know is $170.10 a month. Most people will pay that. Okay, not everybody. There are ways around that. If you're collecting Social Security, your premium will be deducted automatically from your Social Security check. A lot of people always ask me, most people now are kind of waiting on Social Security. They say, well, what if I'm not collecting Social Security? How do I pay that premium? You will be billed quarterly. So if you don't collect Social Security, write that down. You're going to be billed quarterly. And you're allowed to set up however you want. Well, I shouldn't say however you want. You can pay it quarterly if you want with a check. You can go online, create an account, pay it on there, or you can have them deduct your checking account automatically every month. Now, for people who have Medicaid, remember Medicaid is limited income and assets, they don't have to pay that Medicare premium at all. So it's very important. If you think, hey, you know what? I just had somebody recently, her income was $990 a month. She was single. That was her total income. I said, you're going to qualify for Medicaid, no problem. You won't have to pay that Medicare premium. Because could you imagine if your income is at $1,000 a month and you have to pay $170 to Medicare, it would just crush you. So, if you're kind of worried about that and you're thinking, well, my income is kind of low, we can apply for Medicaid. Otherwise, you have to pay that $170 a month. But some people will even pay more than that. So if you have a higher than, I'd say, normal income, you might want to pay attention to this next slide. Some people even pull their phones out and take a photo of this or screenshot, however you can. I know it's a lot going on here. But But this is saying for people who have high incomes, you're going to pay more for Medicare. So if you don't have an high income, don't worry about this page. And I'll tell you the numbers right now. Do you file individual, single? Do you make $91,000 or less? If the answer is yes, don't worry about this page. If you are married and filing jointly and you make $182,000 or less, you're okay. By the way, they will always look, the government's going to look at your income from 2 years ago. So right now we're in the year 2022. This whole year, they're going to look at your 2020 taxes. They're going to check out your modified adjusted gross income over here 2 years ago. Next year, they're going to look at everybody's 2021 taxes and so on. This is called IRMA. If you hear anything, if you get anything in the mail about IRMA, income related monthly adjustment amount, it says the more money you make, the more we're going to charge you for Medicare. That's right. Common problems with this are people that say, Chaz, I'm retiring this year when I start Medicare, but 2 years ago, my income was very high. It's not high anymore. Is there a way around that? Yes, we can appeal it. We can appeal it to make sure you don't have to pay that penalty because you're not making that money anymore. You're retired. Another issue is I had this happen this January. I had a client. She was signing up for Medicare. The first question I asked her was, Miss Johnson, whatever her name was, I said, hey, do you make $91,000 or less as of 2 years ago? She said, oh, yeah, I made, let's say, $50,000. I'm okay. I said, no problem. If that's your income, and if it stays that way or less, you'll be fine. You're only going to pay the Medicare minimum. 2 weeks later, I spoke to her. We were finalizing everything. She said, hey, I just want to mention to you, I'm retiring, and I have a $250,000 in a 401k. And I said, well, congratulations. Hopefully you're not going to cash that out. And she said, yeah, I want to actually take the money out and pay off my credit cards and pay off my home and fix things up. And I said, okay, if you do that, if you have a 401k and you retire and you want to take it out, you want to roll it over into an IRA and you want to take yearly installments. If she were to take that as a lump sum, $250,000, she's going to have higher taxes, right? Because now she's no longer somebody who made $50,000. She'll make $300,000 that year. So she's going to pay taxes based off somebody who makes $300,000. She's going to be in a higher tax bracket. But not only that, I'm not a tax advisor, but I can advise her on this. And I advise her that I would not do it because look at this. If you're a single filing individual and you're above 170,000 and lower than 500, which would have been her 2 years later, her Medicare premium would have been $544.30 every month just for Part B. And she would not be able to appeal that because she did not have a change of events. So she decided to take the money out. And she would have paid that and not been happy. So thankfully, she told me about it. And we ended up rolling her money over into an IRA. Now she's going to take yearly installments out that keep her under this 91,000. She can still pay off credit cards, still do all this stuff, and actually earn interest while she's doing it. So be careful there. Talk to me if you're worried about any of the situation. So be careful there. All right. Hopefully you guys got that written down. Next slide. All right. So we talked about Part A hospital. We talked about Part B medical. Now we're going to talk about the third part of Medicare, which is probably what you guys have seen on TV all the time. It's kind of annoying, is the Part C Medicare Advantage plans. These things are advertised like crazy. And unfortunately, you're going to see even more and more in the next few months because of the annual enrollment period. But these plans are just private insurance companies trying to sell you something. Even though you see Joe Namath on TV, you see Joe Namath talking about these Medicare, these plans will give you extra dental, extra vision, transportation, cash back in your Social Security check. It seems like some program that you got to sign up for or something. No, it's a Medicare Advantage plan. It's not anybody that's special. It's going to be, if you have Medicare, you can get these plans. If you call that number on the Joe Namath commercials, you're going to get a room full of probably 200 people answering phones, lots of noise, and they're just going to say, oh, here's a plan, here you go. That they're just showing you private insurance companies. I can show you all the plans just the same. But what they do is they combine your Part A hospital. Remember, because you got your Part A card, you have your Part B on there, and they say, hey, because you have A and B, you're eligible for a Part C Medicare Advantage plan, and you get a card from whatever company you want. And oh, by the way, like Joe Namath said, they're going to throw in drug coverage. They're going to give you dental, vision, hearing, over-the-counter benefits. Every company is different. Some companies now are giving robotic pets, groceries and stuff like that. Don't be thrown off by all that extra stuff. Look at what the meat and bones of the plan are. You want to know, what are the co-pays if I were to be hospitalized? What's the maximum out of pocket? What are my drug costs? But we'll talk about Advantage plans more in a little bit, but just know they are private insurance companies: Humana, United Healthcare, Florida Blue, Health First, all those companies you always hear about. We'll talk about those a little bit more in a minute. Okay, the fourth and final part of Medicare is your Part D drug coverage. I just mentioned those Advantage plans give you Part D drug coverage. Well, what is Part D drug coverage? It's the only way you can get drug coverage through the Medicare system. It started back in 2000, I believe, 5, somewhere around there, a few years before I started. But Part D is optional. You don't have to take Part D. I actually had a lady email me yesterday, and she said, Chaz, I'm getting my medications using GoodRx. What do I have this drug plan for? And I said, well, you don't have to have the drug plan, but guess what? If you don't take a drug plan when you're first eligible, there's a 1% penalty for every month you go without drug coverage. And I even told her that. I reminded her, I said, hey, we can cancel it. I go, but you're going to have a 1% penalty, about 35 cents every month, and it accrues. So after 2 months, you're at 70 cents, 105. It keeps on accruing. So a few $3 or $4 a year accrues, and every year you go without it, you're going to have that penalty forever. It will never go away, every single month. So be careful if you don't have drug coverage. Now, there is limited exceptions. Again, if you are working or if your spouse is working and you have coverage, creditable drug coverage from that employment, you can delay Part D because you already have creditable drug coverage. If you have VA benefits, that's the military, you don't have to have Part D drug coverage. If you have TRICARE, you don't have to. If you have CHAMP VA, you don't have to have a Part D drug plan through the Medicare system. Those are the only ways around it. If you say, well, Chaz, I have a marketplace plan that I pay on my own insurance. Nope, that is not credible drug coverage. You will be penalized. You can enroll in Medicare drug plans during that same 7-month window, 3 months prior, the month of, and up to 3 months after. After that, your penalty will start to accrue. And then you can change drug plans once a year. That is known as the annual enrollment period. I have over 1,000 clients now. I have on my other monitor over here, my client list up, and 1,066 I have on there. Every year when October hits, reach out to everybody and say, hey, it's that time of year. How's your drug plan been? Is it good? Is it bad? Here's what it's going to do next year. They can change plans only once a year. Now, this is drug plans, not Medicare Advantage. But drug plans, you can only change October 15th to December 7th. I don't expect you to remember that. None of my clients, they don't have to remember that. I make sure my emails go out saying, hey, this is a time. I have right now a template I'm making that's going to go out to everybody. And it says, go ahead and send me your medication list and your preferred pharmacies. And then we can see what drug plan might be best for you next year. Whatever plan changes you make become effective January 1st. So that 7-week window, that's it. And be careful. There could be up to a $480 deductible. I think next year that goes to $505. So there could be up to a $480 deductible on your drug plan. So make sure you know the ins and outs of your drug plan. Like I mentioned before, there's only one way to get drug coverage through the Medicare system. That's Part D, but there's 2 separate options to get. You can either get one of those plans, like on TV, the Medicare Advantage plans. They will integrate your drug coverage into the plan. So I signed up somebody yesterday with the United Healthcare, Medicare Advantage plan, and they said, well, what about drug coverage? Oh, your Advantage plan already has drug coverage in there, so they don't have to buy a separate drug plan. But maybe you don't want that Medicare Advantage plan. Maybe you say, I don't like that option, but I want drug coverage. Okay, you can buy just a standalone drug plan, a package. It has the copay that's going to have a premium, but that's another way to get drug coverage through the Medicare system. And again, if you make too much money, you can pay more for your drug coverage as well. So if that one slide that we saw a few ago affected you because of your income, it will affect your drug coverage as well. Even if you're on a plan that doesn't cost anything, they can charge you more for your drug coverage. Again, $91,000 or less, you're okay. Filing jointly, 182 or less, you're okay. That using that client that I talked about before, her income was only 50,000, but if she took that 401k out 2 years later, they would have looked at her income and said, hey, you made $300,000 that year. Not only are you going to pay $544 a month for Part B, but you're also going to pay an additional $71.30 for your drug coverage as well. She would have not been happy. That would have been an extra $610 or so each month just for Medicare. So be careful there. And again, it's based off your modified adjusted gross income. And this is called IRMA, Income Related Monthly Adjustment Amount. Any questions about that, you can always talk to me afterwards. I can go over that again with you one-on-one basis. All right, so we talked about the 4 parts of Medicare, right? And we're going to get something a little tricky here. I want you to remember the word parts. I know when I was being taught this back in 2009, the guy didn't hammer it home to me enough, and I completely got lost. So remember, there's Part A, Part B, that's your original Medicare, Part C, those private insurance plans, and Part D, drug plans. If you see any other letters, that's not going to be a part of Medicare. So that's what we're going to talk about, Medicare supplement plans or Medigap plans. There's that word, gap, right? We talked about that earlier. Remember I said Part A, which is your hospital, had those different gaps, the 377, the 1556, the 789, those numbers, those are all gaps in Medicare. If you choose a Medigap plan or a supplement plan, it supplements or covers the gaps of Part A and Part B. This is another option that people have to be able to purchase. If you saw those numbers from Part A and Part B and said, man, if I get hospitalized, I don't want to have to pay all that. I want something to cover it. You can instead choose a Medigap plan to cover all that. It's completely optional. All Medicare supplement plans are identical in benefits, which makes it easier for you to shop. Here's where it gets a little tricky. This is a chart. You do not need to write this down. I have a booklet. I think I have it in my work office today, but I have a booklet that I can send to you by PDF, just by email. It will have this chart on there, so you don't have to worry about writing this down. But this is a Medicare supplement or Medigap chart. Every insurance company must abide by this chart. The government back in the mid-90s came up with this, and they said, you know what? We're going to list all the benefits that you are allowed to cover, United Healthcare, Florida Blue, Cigna, all the companies. And this is all you can have on there. If it's not here, you can't add it on there. Now, what are these benefits? These benefits are everything I just went over you with. The Part A coinsurance, the Part B coinsurance, the blood, skilled nursing care, Part A deductible, Part B deductible, excess charges. Everything you see on the left-hand side is the gaps that I talked about earlier. Now, what you see over here is A, B, D, C, F, K, L, M. Those are supplement plans. For some reason, in the mid-90s, the government standardized these plans and decided to letter them. So remember I said before, remember the Parts A, Part B? This is actually Plan A, Plan B, Plan D, Plan G. These are not parts of Medicare. To give you an example, back in 2009, the guy that was training me said, Chaz, quick, what is Plan D? And I didn't hear that word plan. I just heard part. I just heard D. And I said, oh, Plan D is drug coverage. He said, no, that's wrong. Part D is drug coverage. So if you're reading a pamphlet or anything I send you, make sure you know if it says part or does it say plan. If it's a plan, it's an insurance plan. Let's go to the far right over here and look at Plan F. Plan F is the most Cadillac coverage that anybody can get. It's the most coverage you can get. I have maybe 100 to 150 people on Plan F. Every year I talk to them and I say, how has your Plan F been? And I already know what's going to be. It's going to be as great. Medicare pays first. Then all those gaps that were left there, the Plan F covers all of it. If somebody that you know has a Plan F and Medicare, they will never have a copay for anything under Part A or Part B services. Notice I didn't mention Part D because that's drug coverage. Supplement plans are only allowed to cover everything on Part A and Part B. Now, unfortunately, with Plan F, you had to have been on Medicare prior to January 1st, 2020. So most likely, if you're here today, you were not on Medicare prior to January 1st, 2020. That said, Plan G is the new Cadillac coverage. So don't think, oh my gosh, of course I can't get the good plan. There's still great coverage, and that's Plan G. Plan G will check off every box, just like that Plan F, right? Except for one box right here. Now, I can't see you guys or hear you, but when I do my in-person seminars at the library, I'll ask people real quick, how much do you remember that Part B deductible? Immediately people blurt out 170.10. That's actually the monthly premium. Remember, there's a premium for Part B, then there's the deductible. The deductible is what do you pay before Medicare will pay anything. Then usually somebody yells out, oh, 233, and that's correct. So under Plan G, if you were to be hospitalized, you would pay zero for all inpatient services, hospitalization, room and board, the nursing, meals, stuff like that, all covered at 100%. Skilled nursing care, 100 days are covered at 100%. Part B, as long as you've met that deductible, Plan G covers you at 100%. No other cost. Now, there are other plan letters here that I have done, I've signed people up with, but just for time purposes, we're only going to talk about Plan G right now. Okay, so let's talk about your Medicare options. Now, we know eventually you're going to go onto Medicare, and you're still right now saying, I don't know what to do when I go onto Medicare. I have no clue. Now, either you're going to go on Medicare this year, next year, or maybe I talk to you on the phone in the next week, and you say, Chaz, my spouse is still working. We're going to keep that person's coverage from work. No problem. Let me know. I put that in my notes, and I might talk to you 3, 4, 5 years down the road. And at that point, you're going to have Medicare, right? So everybody here eventually is going to get Medicare A and B. You're going to have two options. Option number one is to choose a Medicare supplement or Medigap plan that covers your original Medicare, A and B. And then you decide that you want to add drug coverage as well. Then you're done. Nothing else to do. Maybe you say, you know what, Chaz, that Medigap plan sounds nice, but that's too much for me. I don't need that much coverage. I like what I see on TV with those Joe Namath plans. Well, maybe you choose a Medicare Advantage plan, which includes your drug coverage already. I can't see you guys again. So another option would be if somebody tells me they have TRICARE for life. You guys might not have that, but if you do, TRICARE means you don't have to do either one of these options. TRICARE is only for fully retired military members and their spouses. So if that's not you, don't worry about it. But at this point, somebody says, well, what if I have TRICARE? Okay, then you do Medicare and TRICARE and you're done. Otherwise, eventually you're going to do one of these options here. So I want to make sure we compare, first off, the benefits. So if you're looking and you kind of get an idea of which way you're looking, and when I talk to you in the next week or two, I'm going to ask you, do you think you're looking more at option number one or option number two? And hopefully by the end of this, you have a better idea of which way you're looking. First, we're going to compare the benefits, Medicare supplement versus Medicare Advantage. Okay, Medicare supplement says that Medicare is your primary, and just for time purposes, we're talking about Plan G as your secondary. You can go to any doctor, any hospital in the U.S., assuming that they accept Medicare. If you find out the best brain specialist is in Chicago, your only question to them is, hey, doctor, do you take Medicare? If the answer is yes, you have full coverage there. There are no copays. Doctor visits are free. Specialists are free. Emergency room, urgent care, hospitalization, chemotherapy is all free, assuming you've met your Part B deductible for the calendar year. So calendar year deductible. This is very good for somebody who says, I don't want to have to worry about what is this going to cost me while I'm laid up in the hospital. I don't want to worry about these bills coming in. There's no other out-of-pocket expenses when you use the plan. Don't forget, you must add drug coverage that's separate. People that choose these typically want the Cadillac coverage and they're willing to pay for it. They don't want to have to worry about where can I go to, what doctors can I see. They don't want to have to worry about referrals. They don't want to have to worry about copays. And they don't want to have to worry about prior authorizations. That means they don't want to have to worry about insurance companies approving it or denying it. Now, maybe this is too much coverage for you. You look at it and you say, you know, that looks great and all, but I don't want to pay for extra coverage. You might look into a Medicare Advantage plan. This is going to be more similar to what you might have today from your employer, or it's more similar to what I have. They're made up of HMOs and PPOs, which means, yes, you're going to have a network. Now, that does not mean that the plan picks who you see. We all have been used to a network. I have a PPO. I still have a network. I have an in and out of network. HMOs, if you decide, hey, Chaz, I want to look at option number 2, Medicare Advantage plans, I'll say, no problem. My next question is HMO versus PPOs. How do you feel? HMOs require you to see a primary doctor before seeing a specialist. That's not 100% true, but it is mostly true. Not always true, though. PPOs, you don't need a referral to see a specialist. HMOs, you must stay in network. If you go out of network, you're not going to have any coverage. PPOs, like I have, you can go in or out of network, but if you go out of network, you're going to pay more money. And sometimes a doctor out of network, like my chiropractor says I'm out of network, I have to get reimbursed from my insurance company. So PPOs do give you more freedom. I can still go to a place that doesn't take my plan, but it's a little bit more pain if you do. But you do get more freedom. You might say, well, why would anybody choose an HMO if you have to jump through more hoops? HMOs are typically going to give you better copays, lower copays than their PPO counterparts. When I say copays, I mean, let's say you go to your specialist. An HMO might say, hey, it costs $15 for a specialist, where a PPO might be $35 for a specialist. There are no deductibles. So if you get an MRI done, a plan will not tell you that you have to meet a $2,000 deductible, then it's covered. No, it's going to be you paid this copay. Everything's copays, $200, $100. On primary doctors are typically free, but not always. But most of the time, plans will not charge you for a primary doctor. And you have an out-of-pocket maximum too, which is good. They limit how much you have to spend in a year, so that's good. And another nice thing is drug coverage is included. Just like they say on TV with Joe Namath, is you get drug coverage. People like these because they get extra benefits like dental, vision, hearing. Some get cash back, over-the-counter benefit. Every plan is different, though. So don't just assume they all do the same thing. People that want these because they want the lower premium, they don't want to pay the higher premium. Their doctors might already take the plan. They've been used to this kind of coverage their whole life and they're comfortable with it. Drug coverage is included. You get one card that you use for everything, very easy. So you know the benefits difference. And most people, after they look at this page, still don't know which side they fall on. So if you happen to know, hey, write that down. I like this plan better. But now we're going to talk about the cost difference, because this is what changes people's minds. Like I said, my mom started Medicare in May, and in January, I had this same conversation with her one-on-one. This made her decide right here. So let's say you're liking that Medicare supplement plan. Chaz talked about that Medigap plan. I like that. What's that going to cost me? These are all estimates, but we know that Part A most likely is free. We know that. Part B most likely is $170.10 a month. You have to have A and B in order to get a supplement plan. So on top of that, a supplement plan can run you roughly $175 a month. Males cost more. Smokers cost more. Different area codes or zip codes, cost more. And drug coverage starts at $7.70 a month. So you can easily be spending $352. For some people, they will welcome that if it gives them better coverage than they have now. I have people that I had a husband and wife are paying $2,000 a month for their health coverage with a $5,000 deductible. Going on Medicare was cutting this not even in half, like in a third or a quarter of the price for better coverage. For other people, they might look at that. My mom looked at that. She said, Chaz, I really don't want to pay that much money per month. No problem. the Medicare Advantage plan is a great option as well. We know that Part A is free. We know that Part B is most likely $170.10 a month. Believe it or not, Joe Namath is telling the truth on TV. He says you can get these plans at a zero cost, $0 per month. It will not cost you anything to purchase a Medicare Advantage plan. Even when I sign people up, they're still kind of shocked. They're like, so what's this plan going to cost me? The plan does not cost you anything, but you have to be on Medicare in order to get it. Now, some plans will reduce the Part B premium up here. Some people want that. So when you hear on commercials, get cash back in your Social Security check, that's what they're talking about. They reduce the Medicare premium. If that's something that interests you, let me know. That's because you're saying I cannot afford that 170.10 or do not want to. You're obviously going to be giving up something. So there are options for somebody who just says, Chaz, I was paying $20 a month for health insurance. Now it's going to be 170. I can't do that. Okay, let's look at your other options. Drug coverage is included. You don't have to pay for that. So your total out of pocket is going to be 170.10 or maybe less. But don't forget, you're going to have copays, specialists, hospitalization, stuff like that. Common question is, if I choose a Medicare Advantage plan right now because I'm healthy, can I get a supplement plan at a later date? Yes, you can. But there will be health questions. Medicare supplement plans do not have health questions when you're new to Medicare. When you first sign up for Medicare, they have to take you. I don't care if you have cancer, anything in the hospital, currently in the hospital, they have to take you. They have to accept you, and they cannot not cover pre-existing conditions. They have to cover everything. Medicare Advantage, they always have to take you. They cannot decline you. But 6 months after you've been enrolled into Medicare, if you decide at that point you would like a supplement plan, they're going to ask you, have you had a heart attack recently, a stroke, cancer, COPD, all this different stuff. So it's important to make the decision that you want now and forever. If you know that you want a supplement plan, but you don't think you want to do it right now because you're healthy, well, you might not be able to get it in the future. If you choose an Advantage plan, you can change those once a year. I just want to make sure you know that if you go to a supplement plan, there are health questions later on. Hopefully that made sense for everybody. Be sure to ask me a question if they want more answers or more questions about that, because it can be tricky. And again, we can talk one-on-one too. I can talk about your specific situation. Okay, so when can you change all these things? When can you pick up stuff? Well, like I mentioned before, you guys are probably in or coming up to your initial enrollment period, which is 3 months prior to your month of eligibility, the month of and up to 3 months after. That's when you can sign up for Medicare and you can sign up for a plan. You can change drug plans. We know that, right? Once a year, October 15th to December 7th. So I have an email that goes out to all my drug plan clients saying, hey, this is when you can change your drug plan. Then I have another email that goes out to everybody that has a Medicare Advantage plan. And that's another time where they can also change their plan, October 15th to December 7th. Any plan changes they make become effective January 1st. Then you say, well, what if I'm outside those dates, October 15th to December 7th? Well, there's also the special enrollment period. That's if somebody were to call me and they say, Chaz, I just moved to another county, or maybe they lost employer coverage. There's a special enrollment period where you can change plans in the middle of the year, anytime. Then the final one is the open enrollment period. January 1st through March 31st, you can change your Medicare Advantage plan only to another Medicare Advantage plan, or you can just go back to original Medicare. You cannot change your drug plan. That's why it's important that during that 7-week window up here, during the annual election period, that they make a drug plan change if they want to. But Medicare Advantage plans, they get a whole another 3 months to make changes. So they get a long time. And I reiterate that to everybody who I signed up somebody yesterday, like I mentioned, on a Medicare Advantage. She starts on October 1st. And I said, look, you'll have October 1st. You can change to before the end of the year, or we could even change at the beginning of the year. You know, if we need to, you're not really locked in that long. All right, when should you enroll in Medicare? This is a big question for everybody. When do I enroll? Okay, first ask yourself, are you still working or is your spouse still working? Oh yeah, we're working. Do you have health coverage from that employer? Yes, I do. Okay. Well, you can stay with that group insurance, assuming it's more than 20 employees and it's creditable, and you can delay enrollment into Part B without any penalties, no loss of options. You'll be able to get Medicare in the future. I show clients how to do that every single week. I have people that call me and say, Chaz, I need to delay Medicare. Then the next day, I might have somebody call and say, hey, 3 years ago, you helped me delay Medicare. How do I get it back without any penalties? I show you how to do that at no cost. Maybe you're still working and you have coverage from your employer, but it's not good. Maybe it's a very high deductible. Maybe it's not creditable. Maybe it costs you a lot of money. Well, then you want to enroll in Medicare. I can show you how to do that. And you get a Medigap or a Medicare Advantage plan. If you're collecting Social Security benefits right now, your enrollment into Medicare is automatic. You will get a Medicare card in the mail 3.5 months prior to starting Medicare. Now, if you have group insurance, you might want to send that card back and say, no, I don't want Medicare. Or maybe you get your Medicare card and you say, I have a government retiree plan. Okay, that works together. Or if you don't, you might want to choose a Medigap or Medicare Advantage plan, but you got your card automatically because you're collecting Social Security. If you're not collecting Social Security, that's more and more. I get that every year where people are waiting. Your enrollment into Medicare is not automatic. You will not automatically get that Medicare card in the mail. You have to manually sign up for Medicare. Now, what if you say, well, I'm not collecting Social Security, but I don't want to take Medicare yet because I still have coverage from work? Well, we actually still have to delay Medicare. We got to let them know you don't want Medicare. When you delay Part B, that will give you Part A. You might as well have it. It's free, right? Or maybe you're not collecting Social Security. You say, Chaz, I need to sign up for Medicare. How do I do that? I will show you how to enroll in A and B, and you can pick a Medicare Advantage or Medicare Supplement if you choose to. How do you enroll? You can enroll by calling Social Security. I don't recommend this way, but if you need to do it, some people don't like going online. You can call Social Security, wait on hold. 30 minutes later, they pick up. You tell them, I would like to enroll in Medicare. You can do that 3 months before or 100 days before your birth month. They will actually call you back. They'll say, well, you know what? We're going to call you back in 2 weeks with an appointment. They call you back, you wait. Then you can enroll in Medicare on the phone. Yes, you call Social Security. You don't call Medicare. Or, excuse me, you can enroll online. You have to have a Social Security account set up. That's how you're going to delay Medicare or enroll in Medicare. Schedule a phone call with me. I will, at the end of this presentation here, you're going to have a little slide out. My calendar will pop up. You can pick any day and time. It's a quick phone call, 5-10 minutes. I will get notes to figure out what to do, and then we will talk about when do you need to enroll or delay Medicare. That's what I recommend doing for everybody. And again, I can never, ever charge you anything. You can never give me any money. What I recommend all of you doing today, if you have time, is visit ssa.gov. Create an account. I have an account. My wife has an account. Hopefully everybody who attends my webinar and seminar creates an account there. If you already have one, great. If not, you're going to want to click sign in, sign up at the top right-hand corner. This does not sign you up for Social Security or Medicare. This gives you the ability to do it in the future. This is just creating an account. Then on the left-hand side, you're going to click My Social Security because you're not doing a business service and you're not a government service. We're doing My Social Security. Then you're going to click at the bottom, Create an Account. And then for whatever reason, it opens up a new window. Then you have to click Create Account again. They redid this last year, and I think they made it kind of worse. Hopefully, you've already had an account set up with them. You can just log in at the top. If not, you have to log in with login.gov. So you click Create an Account, Create an Account. It's going to go through the steps. It has you put in your email address, your phone number, all this different stuff. They're going to verify that it's you that's actually talking to them. Then when you talk to me in the future, I can show you how to go on there and enroll in Medicare or delay Medicare. All right, so then once we get you approved for Medicare and you got your Medicare card, we're looking at Medicare supplement plans. Maybe you want to see a Medigap plan. There are 26 carriers with the exact same 10 plans. How do you know which one to choose? That's where I come in. I know all these plans like the back of my hand. I can show you what's available, what's going to be the best price for you, what's a company that doesn't have big rate increases. Don't just automatically choose one because you've heard of them before. I do work with all the different companies though. Drug plans. We have 22 different drug plans available here in Florida. Cheapest is not always better. Most expensive is not always better. So we got to find the right blood drug plan that is made for you based off your medications. Part C Medicare Advantage plans, the ones you see with Joe Namath with. There are 53 different plans. Depends on the county. I'm in Orange County. We got about 53 plans. Brevard County might have around 45 plans. Stewart might have 45 plans. Just depends. Miami has like 80 plans. So there are a lot of different plans. No reason to try to navigate this on your own. I know exactly how to narrow this down to just a couple of plans for you, but everybody's different. Here are Medicare partners. I have actually more than this now, but these are a lot of the companies that I work with: United Healthcare, Florida Blue, Aetna, Cigna, Devoted, Humana, Health First over in Brevard County, Freedom, a lot of different companies. I work with them all. All right, what happens next? Well, I have that Medicare 101 booklet that I mentioned that will be everything about Medicare, Parts A, Part B, Part C, and D. It'll have the Medigap chart in there. Request this copy. How are you going to do that? Well, once you exit this webinar, or when I end it here soon, a survey is going to pop up. It's going to say, thank you for attending. We'd love to hear the thoughts about the presentation. Please do that survey for me. It's a very quick survey, and on there you can actually check the box off that you would like to have that booklet, and I'll email it to you. Usually within a day or two, I'll email it to you. Thank you for attending. You can schedule an appointment with me. You will get a thank you email. Thank you for attending. That is automatic. It goes out to the system. Also, if you do not schedule an appointment with me, my assistant will reach out to you. But I recommend going on right now. Just go ahead and schedule. I'll show you right here. A little thing slides out right there. It says, do not wait. Book your one-on-one. If you click that link right now, I'll click on it. My calendar pops up. And I don't have any times left this week, but next week I have times and dates available. You can schedule a quick, 5-10 minute phone call with me to kind of get an idea of what you are looking for. If you don't schedule an appointment, Sue will be reaching out to you just to get that phone call out of the way. I didn't hear any questions from anybody, but if you have any questions, go ahead and answer or ask them now. And that cell phone number is a number I've had since 1997. It's not going anywhere. You can always call me, text me. You should have my email address by that email that will come out. But I hope to talk to each one of you very, very soon next week. Go ahead and click on that calendar. All right, guys, no questions. I thank you for attending. We got right at almost just over an hour here. So, all right, talk to you soon. Let me hit the end button here. All right, guys, bye. Thank you.